So basically, I'm going to show you photos. We'll do the occlusals here because this is easier when the patient's horizontal. But I prefer the patient sitting basically in a chair like over here, which you'll see in a minute when we go over there for the rest of the photos. So the only photos we take ideally are the occlusal photos here. Sometimes while you're in treatment and you want some in-treatment photos, I don't really get them to get up and go over there. I just do my best here. But doing them upside down, you can often get everything kind of canted and not quite right. But for treatment photos, I accept that because I don't want to move the patient all over the place. So Amanda's going to put these in. For the occlusal photos, the main thing we do is metal retractors. I find it just works better. And then we use this mirror with a handle. And I'd rather have titanium mirrors. The titanium mirrors are brighter. We ordered some other mirrors at one point that weren't titanium. They were terrible. They were too dark. And hard to take pictures when they're dark like that. Yeah. Big mouth. Oh, yeah. Yeah. So this is like a handle mirror from PhotoMed. The only problem with these are these little, no, I just want to show. This can come off the mirror, and they said if there's ever that issue, just send it back to them. They'll repair it and send it back to you. So just open, Melissa. So open wide. So the big key is retracting up the lip with these retractors. And then open, and then you got to keep the mirror against the lower arch. Otherwise, it's not back far enough. And then Amanda also blows some air on there. That's not bad. I'm having a hard open a little. Just stay there for a sec. That's the place you want to find. And that's good. And then all I'll do now is I'll crop it. I'll show this tomorrow. I'll put them up. We'll be here till midnight, but I'll show it tomorrow. I focus in the middle of the arch for an occlusal. Because I'm using a high enough f-stop that it's got a large depth of field. So I'm at f22. I could even be at f30 if you wanted to. I prefer shooting around f22, f25. Okay, so then the other one, I come over here for the mandible. And if you look, we need to get the lip off. And the mandible's usually easier. And again, that's perfect. See, she's good for occlusals. Not everybody's like that good. And so mirror against the opposing arch. Otherwise, you're too close to the teeth and you can't get the whole arch without a lot of reflections too. So that's occlusals, really easy. There's other things you can use. If you watch the webinar, I suggested a few other tools, but this is the basic setup that we use. And that's, I think, the most effective way of doing it. Some people it doesn't work on. There's different retractors we have, and you can even use an isolate. Optigate. Optigate. We have isolates. Have you heard of those? Isolates?
Yeah, I saw those.
Yeah, those are amazing. We have that right there. But anyway, let's go over here now. No, we're manually focusing. So this is in manual focus, huh?
You have it to a set size or distance, and then you just kind of come forward.
I just slightly move forward and back to focus. So I'm focusing by moving the camera. So no autofocus. You can't really autofocus the macro images at that level of magnification. So I'm pretty much on f22 for all of these. I may switch it over to f25, but I'm on f22 with +1 exposure compensation. So we'll just put, you know what, I'll do the portrait photos. Actually, I'll crank it down to f8. So we're on aperture priority, f8. Now, if you're confused at all by this, it's all in my DVD. It's all there. It's very clear. We spent like a whole day shooting.
Yep,
So yeah, we did. It was a good day.
That was the first day ever.
Yeah, being the patient. So yeah, you just shoot. She smiles like that. That's a good shot, really. Just f8. The only problem with these photos, when you're manually focusing, it's easy to be out of focus. So what I do is I move the little red focus. I'm using single focus on this. I move it down to the teeth. So I'm trying to get it to focus on the teeth. Even though I'm manually focus, I move my focus spot to the teeth, and I'm looking at the teeth. That's where I'm trying to focus. And your eyes were closed. But the first one was good, so it doesn't really matter, but I'll take one more. And then we do a lip in repose, so you'll just, yep. And then we'll come in closer. I've now cranked up to f22. And I just now move it to about the magnification I want. That's good. I'll crop that slightly. And I'm just trying to be, you know, perpendicular to her teeth and parallel to her occlusal plane, so we don't see canting that's not really there. And smile really big again, one more. And now lip in repose. And I'm focusing on the centrals for these two shots, which are the frontal views. And then for the side views, I'll focus on the laterals. Just smile again. Good. You notice I'm just moving slightly in and out to get my focus point. And that's it for those. I usually take 2 of each, just because one might not be quite exactly the way I want it. So digital storage is cheap, so I just take a bunch. So now you can put in your retractors.
Are you using auto white balance for flash?
The flash I'm using, no, you don't want to use, what am I on? I am on auto. Usually I'm on flash. Maybe I took this home. You know, you could use auto or flash. I could change it to flash for a couple. In this camera is so good, auto works. So I'll do one right now. Just bite down. This one is flash.
You get the patient to hold.
Yeah.
Yes. And now I'll do one with auto. As I said, this camera is so good, the auto works well. But some of the older digital SLRs, you're better off on flash.
But you don't do a custom white balance ever.
I have this set up as a custom white balance also, but I don't usually use it. Because depending on the lighting that day, the flash overwhelms the lighting, but the custom white balance is dependent on the lighting. And the lighting varies so much in this room because of the sun that I'm actually just using either auto or flash. And you know what? I think I've been using auto lately. It looks pretty good. I'll see when we import these. But you have to kind of test it out with your camera. I shot this with this camera a lot of different settings, and the one that I have right now seems to be working well for color. So now we do one biting down, one slightly open. Open a little more. Perfect. Close just a touch more. That's good there. And now, bite down. Yeah. She stretches well too, so and she's good at this. And open slightly, but don't disclude. Open a little more. Her lips stretch well. So we get, like, look at that. That's a perfect shot. She's stretchy. And then this way. Like, look, not everybody can do that. Bite down. Yeah. Slightly open, a little bit more, a little bit more, little bit. That's good there. Okay.
And so yours just coach your patients through this?
Yep. Yeah.
Yes, that's basically what we do.
Are they
Yeah.
all that good at holding the retractors?
No, usually
I
I come in, have to hold them, or somebody.
Well, I would say 99% of our patients, they hold the retractor.
You just have to kind of hold their hands.
I just
and then
show them
just
where to
have
put their hands. Yeah, usually they are fine. They do a lot of that. But Amanda does, she's kind of here to tell them what to do and direct them and boss them around a little. And she uses this. So for the macro upper anteriors, we use this. And this is just from Photomed. It's called a contraster. And this does really good. Those photos that you see, my close-up photos where the background's blacked out, this works really well for that. So open And we want to get it back far enough and up into the palette enough that you don't see anything behind it other than the black. And here we are. Oh, what happened? This is,
Good.
oh, the battery just died on that. Okay, so we're in business. So I've kept this, all these photos are a f/22, basically. And I think it's reasonably good for these. And you have a little saliva in between your teeth. If you can just, yep. That's perfect. These are the hardest ones when you're manually focusing. It's easy to be canted a little bit or whatever. So these ones are the ones that I edit. Because you're getting that close, it's a challenge, autofocusing. Sometimes I'll brace my knee against the chair like this, just to stabilize myself. And then I'll do 3 of the lower incisors. And that'll complete the 20. So just open and lift your chin up. I'm trying to get her lower arch like nicely parallel to the horizon. That's that one. Then we'll do this one. And then this one.
Done?
Yeah, I'd say that's good enough. I can rotate that one. I was a little turned. So that's basically it. You know, it's pretty simple. And the big thing about photography is just practice, practice, practice. You have to do a bunch of it. If you do a bunch of it, you'll get good and get better at it.